everyone, it's day 23 post-op and I'm feeling pretty great, and I wanted to do another update just to kind of let folks know how I'm doing and what I've been up to since the last update. Since the last update, I've started physical therapy and I've now had 5 sessions, which have been wonderful. They take really good care to make sure they follow the no bending, lifting, twisting, or BLT restrictions for the first 3 months. So doing a lot of stretching of the neck and just trying to strengthen the muscles in the neck area, and work on getting the range of motion back within the neck, looking left and right, up and down, which has actually also helped me drive. I drove for the first time last week, ironically, to my physical therapy appointment. So that was kind of nice to be able to get in the car and drive. The hardest part was probably trying to look left and right to make sure that there was no one coming, when I was turning left or right. Just had to take an extra second or two to make sure I looked left and right long enough to make sure there was no one coming to make turns going left or right. Everything else was pretty easy. Just made sure I moved the seat up a little bit to give my back stability and my neck some stability to be able to sit straight and forward. Getting in and out of the car wasn't too difficult, just making sure that I kind of back in and sit on the seat first, lift the legs in, and use the steering wheel to kind of turn myself, kind of similar to a sort of a log roll that you do in bed. So that's been great. Physical therapy and being able to drive, really great on the psyche. I feel a lot more independent being able to go out if I want to go walk around a store or just go to physical therapy or going back to work next week. I know that I can get in the car and drive, and like I said, just another second or two just to make absolutely sure it's safe to turn. Everything else though has been great. I would say that my incision is doing really well. It's been 3 weeks and 2 days, so 23 days. The puffiness of the incision is going down along with the pinkish color kind of fading away and normal skin tone coming back. So that's been really great to see the progression there on the incision. I'll do a close-up here shortly. All right, so I promised I would do a up-close shot of the incision. So here you can see there you can see the incision is about 23 days old, and I think it's doing pretty well considering how soon it is since surgery. Everything's closed up nicely and the swelling and things are starting to go down, and the bruising is pretty minimal at this point. So very happy and pleased with how it's going. Can't wait to see how it looks after a month or two. The other thing has just been some aching, but that's normal coming out of surgery, and especially going to PT and getting that range of motion back and exercising the muscles in there. So that's to be expected, and I knew that. Thankfully, again, it's all controlled by Tylenol, and I just take a muscle relaxer still at night to sleep. Speaking of sleep, it seems to still be my biggest Achilles heel, getting sleep at night, but I find myself waking up in the middle of the night trying to get comfortable again, struggling to find that comfort level. I do get comfortable and go to sleep for a little while, but I do find that I wake up at least once an hour or hour and a half to turn over or to try to get comfortable, or just sit up in the bed sometimes and then try to regroup. Sometimes I'll just watch TV and then eventually fall back asleep, or I'll get out of bed early in the morning and try to take a nap maybe later in the morning or something like that. So I'm hoping once I get back to work and get more into a routine of getting up early, going to bed early, I'm hoping that I can work on getting sleep during normal hours, and also finding comfortable positions further along in my recovery. I'm hoping that eventually would be easier and not be such an issue. One of the other issues, if you're like me, is you tend to go stir crazy being at home, especially if you're used to working during the day and not sitting around the house. So I have tried my best to stay within the BLT parameters, but I have found myself reorganizing the pantry or the refrigerator, some of the kitchen cabinets, things like that, reorganizing the bathroom drawers, just things that I can do that don't involve heavy items or not reaching too high, but just kind of busy work to help pass the time and try to keep the stir crazy away, if you will. I think one of the biggest decisions coming out of this type of surgery is how far along you are in recovery, how well you're doing, and if you do work, when is it okay to return to work? I'm not a medical professional, so I can't tell you when that is, but I can tell you that you know yourself better than anyone, and a visit to the doctor's office post-op is definitely helpful as well. The doctor can let you know how you're doing and kind of help you assess how you feel and when you feel like you're able to return to the whatever type of duties you're doing. I will say that I'm returning to work earlier than probably some would, but it helps that I have a desk job. So I do a lot of work on computer and paperwork and things like that. And I actually have a Vera desk where I can actually stand up to do some of my work as well. So that's part of the reason why I'm able to go back after 4 weeks versus maybe taking a little bit longer. The other thing would be some people might go back part-time. I opted to go back full-time after 4 weeks. I'm hoping for the best. I'm hoping that's the right decision. If it's not, I'll talk to my HR folks and see if we can work something out to do part-time, maybe for a week or two to kind of progress back into full-time. But I'm really hoping that just jumping right back in full-time will help with the recovery, just keep it moving along. So we'll see how that goes, and I'll provide another update too about how it is working a desk job and trying to be there for at least 8 hours, and see if I can break it up with, you know, kind of taking a walk, a quick break or something like that, or just doing some neck exercises or things to kind of break it up a little bit so I'm not just sitting in the same position staring at a monitor for 8 hours. One of the other things you may have noticed in the video is this bruise here on my arm. This is left over actually from my surgery. While they were doing the surgery, they had some needles in, similar to the EMG testing that they do to test nerve and muscle damage or weakness. So they had needles in my arms during the surgery itself. And unfortunately, this bruise has remained a little over 3 weeks later. So hopefully that'll go away soon, but I just wanted to point that out because some people may kind of be freaked out by that or bothered, you know, with a bruise lasting that long. I talked to the doctor. It's nothing to worry about. It's just my body is taking a little bit longer to heal with the bruising. All right, so thanks for watching, and if you like the video, click the like button and subscribe.